Hello dear students, today let's discuss a very important topic from our clinical aspect as well as exam point of view, that is Ludwig's angina. So let's start. What is Ludwig's angina? As we all know, there are various neck spaces in our neck and around the floor of mouth and mandible. So Ludwig's angina can be defined as primarily an infection of submandibular space, although it later on eventually involves submaxillary space, sublingual and submental spaces also. So what is the main etiology of Ludwig's angina? That is infection of roots of second and third mandibular molar. Basically a dental infection is the chief etiology of this condition. Other causes are submandibular gland infections, osteomyelitis of mandible, acute pharyngitis, any kind of injury or trauma to the floor of mouth, or fracture of mandible can also contribute to its causes. Now, this is a classic picture of Ludwig's angina. Here we can see there is a bulge or swelling, we can say, in the area of submandibular region. So it is a stage of cellulitis where it will be hard and tender, that we will discuss in upcoming slides. So it is a picture of Ludwig's angina. Now, what are the causative organisms of Ludwig's angina? Mainly, there are mixed flora such as anaerobic and aerobic both. Most common bacteria are alpha hemolytic streptococci, staphylococcus, and bacteroids also contribute to this. Along with it, there are few rare the organisms such as E. coli, Haemophilus influenzae, and Pseudomonas. They are rare as compared to these three. Now, what are the symptoms of Ludwig's angina? Patient present to us with, obviously there will be a bulging neck swelling, and along with that patient will be suffering from fever and patient will have malaise. Also, patient will complain of drooling of saliva, odynophagia, that is difficulty or painful swallowing. And in the later stages, there will be airway obstruction, there will be reduced or restricted neck movement because of the neck swelling, and there will be voice change also. So, what about neck swelling? Initially, in the cases of Ludwig's angina, the neck swelling will be tense and tender. It will be like firm and indurated. So why it is there? Because there will be cellulitis in the initial stages. Later on, when it gets developed into pus, then it will be fluctuant soft swelling. So that is the course of development of neck swelling in the Ludwig's angina. So now coming to the signs that doctor or clinician will elicit on the patient with Ludwig's angina, there will be firm and tender indurated swelling, and there will be swelling of the floor of the mouth. So what is the firm and indurated swelling? Initially, if there is cellulitis, there will not be any frank pus. So only the cellulitis will cause a tender swelling, firm swelling. Also, the skin over the swelling will be erythematous, slightly erythematous. So that is the stage of cellulitis. Later on, when it gets converted into the frank pus, then the swelling will be pus filled and fluctuant. So we can do aspiration or incision and drainage over that swelling. Also, patient will have trismus, that is restricted range of motion of jaw, and there will be halitosis, that is foul breath. Dyspnea and stridor may appear in the late stages. Also, the tongue will be pushed back. Why? Because there will be edema of the floor of mouth. So these are the important signs of Ludwig's angina. This is the image that I have been talking about since last few slides. There is a clear swelling in the floor of mouth just behind the teeth, which is pushing the tongue backwards. So the swelling is marked with a black arrow. It is a classical picture of Ludwig's angina, that is edema of the floor of mouth. Now coming to the investigation, how we can investigate this condition. So diagnosis is purely, I think, clinical. That is based on a history and examination. Patient will give a typical history of dental pain followed by foul smelling from the mouth, and there will be pus discharge from oral cavity, and you have to examine the patient. It will be case of Ludwig's angina. Also, we can order as CBC, that is complete blood count. We can also advise patient to get an OPG, that is orthopantomogram, basically a dental X-ray. We can advise USG neck. We can advise X-ray neck lateral view also to see the extent of retropharyngeal space involvement, if that is also involved or not. Also, we can advise the patient to get a CT scan of the neck with contrast. To rule out mediastinitis, basically that if there is chances of progression of infection to the lung spaces and mediastinum is there or not. So these are the basic investigations that we can order in case of Ludwig's angina. Now coming to the treatment options of Ludwig's angina, if a patient comes to you with these symptoms and signs and you have made the diagnosis of Ludwig's angina, what treatment we can offer? First of all, advise admission to the hospital, and if there is frank pus present, just do an aspiration or simply go for incision and drainage of the pus. Send that pus to the culture sensitivity, and if the reports are awaited, start with an empirical antibiotic. If reports have come, then based on the culture sensitivity report, start injectable antibiotics to the patient. Also, we can give supportive IV fluids as there will be reduced oral intake, and we can give analgesics to the patient to relieve the pain, and we can advise mouth gargle to maintain oral hygiene. Coming to the surgical drainage, what are the indications of surgical drainage? If there is frank pus accumulated, we can see the pus fluctuating under the skin, then we have to drain the pus. Also, if there is any kind of airway compromise or patient is landing up into the stridor, then we can drain the pus. If there is chance of thrombosis of any major vein such as internal jugular vein thrombosis, or chances of erosion of any other major blood vessels, carotid artery, etc., then we have to drain the pus. Tracheostomy at times may be needed if there is any severe stridor or severe airway obstruction, then we can also go for tracheostomy. So these are the few management options of Ludwig's angina, that is both surgical and medical. So now coming to the complications of Ludwig's angina, if not treated in time, patient may land up into stridor or respiratory distress. As there will be pus or infection in the submandibular space, it can always spread to its lateral pharyngeal spaces also. So that may lead also to parapharyngeal space infection and retropharyngeal abscess. Along with that, patient can also develop aspiration pneumonitis, mediastinitis, and laryngeal edema. Patient can have lung abscess. Eventually, all these conditions lead to septicemia, and patient can also die from the Ludwig's angina if not treated in time. So that was all about Ludwig's angina in brief. It is a very important topic from exam point of view, and we also see such cases in our daily OPDs. So it is a very important topic. Please go through this thoroughly and follow us for more such contents. Thank you.